The demand for mental health services is at an all-time high. The latest, most recent statistics show more than 168,000 people were seen by mental health and addiction services last year. That's nearly 50,000 more than just 8 years ago. The rising population, greater awareness and post-quake pressures in Canterbury have all been cited as part of what's behind the increase in demand. New Zealand's suicide statistics remain stubbornly high, with about 500 people taking their lives each year. The country has the highest rate of youth suicide in the developed world. As part of the Is This the Brighter Future series, our reporter Mei Heron and visual journalist Rebecca Parsons-King spoke to one woman about her experience with the mental health system.
Not to be here, not to be anywhere, and soon, nothing more terrible, nothing more true.
In her dark times, Freya Sadgrove finds comfort in the poetry of English writer Philip Larkin.
A vast, moth-eaten musical brocade created to pretend we never die.
The 24-year-old's struggle started when she was a teenager.
I was 15 and I realised that people were really sad, and then I got really sad. I don't know, that's kind of simplifying it a lot, but I was really got really depressed.
Years later, partway through university, things got a lot worse.
I got to a point where I was like, oh, I better tell my parents how bad things are, because things were real bad. So I had to send them an email because I was like, I can't talk about this with my mouth words. So I sent them this sad little email.
She then visited her doctor.
My GP could tell I was really bad. Like, I was really bad. I was like suicidal. I was in a lot of danger. And she was like, 2 weeks. And at this point I was like, 2 weeks was like a very long time that I couldn't imagine getting through.
And unfortunately, Freya didn't get through. She ended up in emergency psychiatric care. After this, her doctor urged her to stay away from the public health system.
If it is possible for you and your family, you should go private if you can, because the public system is overloaded and you will have to wait a very, very long time.
Freya suffers from depression, anxiety and bipolar disorder, but she considers herself lucky because her mother was able to step in and pay for her treatment.
I wouldn't want to be in the public health system, in the public mental health system at the moment, because it is possible for me to not be in it, and therefore like free it up this minuscule amount for someone who doesn't have the opportunities that I have. But if it were a more effective system, then there wouldn't be all these layers of weird guilt.
The number of mental health clients has increased by over a third since 2008 to 168,000. And last year, 200,000 more people were diagnosed with depression and nearly 300,000 more diagnosed with a mood or anxiety disorder than in 2007. Since it took office, the national-led government has boosted mental health spending by $300 million. In this year's budget, it committed an extra $224 million over 4 years. But is that enough? Freya doesn't think so.
There are too many people needing to use a system that doesn't have enough people to deal with like the volume of trouble it's faced with.
She thinks it's mind-boggling that key initiatives are not being funded. Lifeline's 24/7 helpline currently receives no government funding after losing a contract in 2015.
It's good, a lifeline. Like, why would you? That was a bad decision. I have occasionally called helplines, and if I hadn't called them, bad. There'd be bad news for me.
Faced with a system under stress, Freya says she and her friends turn to each other instead. However, it's not always easy speaking up.
I worry about them when I'm that version of myself in front of them, that it will affect them badly, and then I see friends in crisis, and it is really, it's a lot to deal with when you're just a little person going around in the world, and everyone's real sad.
Freya is now working, flatting with friends and managing her illness, and she credits the people close to her for where she is today, and not the mental health system.
My family really helped me, and my friends really helped me, and there are ways, and there should be ways, that it doesn't have to be the be-all and end-all, it doesn't have to crush you.
For Checkpoint, Mei Heron.